Cataracts are a common eye condition that can cause blurry vision and, if left untreated, may lead to vision loss. Understanding how doctors diagnose cataracts is crucial for early detection and effective treatment. In this video, we'll walk you through the step-by-step process that eye care professionals use to identify cataracts, from the initial consultation to specialized eye examinations. Whether you're experiencing vision changes yourself or supporting a loved one, knowing what to expect during a cataract evaluation can help you feel more prepared and informed. Let's begin by exploring what cataracts are and why timely diagnosis matters. A cataract is a clouding of the eye's natural lens, which lies behind the iris and the pupil. This cloudiness can develop slowly and may not disturb your eyesight early on. However, as the cataract grows, it can interfere with vision, making everyday tasks like reading or driving more difficult. Cataracts are most commonly related to aging, but other factors such as injury, certain medications, or medical conditions like diabetes can also contribute. Recognizing the symptoms and risk factors is the first step in the diagnostic journey. The diagnostic process begins with an initial consultation. During this visit, the doctor will ask about your medical history, any vision changes you've noticed, and specific symptoms such as blurred vision, glare, or difficulty seeing at night. This conversation helps the doctor understand your risk factors and determine whether further testing is needed. It's important to be open and detailed about your symptoms, as this information guides the next steps in the diagnostic process. A thorough review of your medical history is a key part of diagnosing cataracts. The doctor will ask about any previous eye injuries, surgeries, or conditions such as diabetes that could increase your risk. They may also inquire about your use of medications like corticosteroids, which can contribute to cataract formation. This comprehensive review helps the doctor assess your overall eye health and tailor the examination to your specific needs. Doctors will ask detailed questions about your symptoms. Common cataract symptoms include blurry or dim vision, increased sensitivity to light and glare, seeing halos around lights, frequent changes in eyeglass prescription, and difficulty with night vision. By understanding the specific symptoms you're experiencing, the doctor can better determine whether cataracts are likely and what further tests are necessary. The next step is a visual acuity test, which measures how well you can see at various distances. You'll be asked to read letters on an eye chart, one eye at a time, while covering the other. This test helps the doctor determine the extent of your vision loss and whether it could be related to cataracts or another eye condition. The results provide a baseline for further examination and future comparisons. A refraction assessment is performed to determine if a new eyeglass prescription can improve your vision. During this test, you'll look through a device called a phoropter, which contains different lenses. The doctor will ask which lens makes the letters on the chart appear clearer. If your vision cannot be corrected with glasses, it may indicate the presence of cataracts. A slit-lamp examination is a crucial part of diagnosing cataracts. The slit-lamp is a special microscope with a bright light that allows the doctor to examine the structures at the front of your eye in detail. By focusing the light on your lens, the doctor can detect any cloudiness or abnormalities that suggest cataracts. This test also helps rule out other eye conditions that might cause similar symptoms. To get a better view of your eye's internal structures, the doctor will perform a dilated eye exam. Special eye drops are used to widen your pupils, allowing more light to enter and providing a clearer view of the lens and retina. This exam helps the doctor assess the severity and location of the cataract, as well as check for other potential eye problems. Once your pupils are dilated, the doctor uses a special lens to examine the retina at the back of your eye. This step is important because it helps rule out other causes of vision loss, such as retinal disease or damage. The doctor will look for signs of cataract as well as any other abnormalities that could affect your vision. Tonometry is a test that measures the pressure inside your eye, known as intraocular pressure. While this test is primarily used to screen for glaucoma, it's often performed during a comprehensive eye exam for cataracts. High eye pressure can indicate other eye problems that may need to be addressed alongside cataract treatment. Doctors may also check how your pupils respond to light. This simple test involves shining a light into each eye and observing the reaction. A normal pupil will constrict in response to light. Abnormal responses can indicate nerve or brain issues, but in the context of cataracts, this test helps rule out other causes of vision problems. A color vision test may be performed to check for changes in your ability to distinguish colors. Cataracts can sometimes cause colors to appear faded or yellowed. By identifying any changes in color perception, the doctor can gather more evidence pointing toward a cataract diagnosis. Doctors may assess your sensitivity to glare, which is a common symptom of cataracts. This test involves shining a bright light into your eyes and asking how it affects your vision. Increased glare sensitivity especially when driving at night, can be a strong indicator of cataract development. A contrast sensitivity test measures how well you can distinguish objects from their background, especially in low light conditions. Cataracts can reduce contrast sensitivity, making it harder to see in dim environments. This test helps the doctor understand the functional impact of the cataract on your daily life. Ophthalmoscopy is a procedure where the doctor uses a special instrument called an ophthalmoscope to look at the back of your eye. This allows for a detailed examination of the retina, optic nerve, and blood vessels. The clarity of the lens is also assessed, helping to confirm the presence and extent of a cataract. Keratometry measures the curvature of your cornea, the clear front surface of your eye. While this test is more commonly used before cataract surgery to determine the correct lens implant, it may be included in the diagnostic process to rule out other causes of vision changes. Biometry is a test that measures the length of your eye and the shape of your cornea. This information is essential for planning cataract surgery, but it can also help confirm the diagnosis by providing detailed measurements of your eye's structure. Corneal topography creates a detailed map of the surface of your cornea. This test is not always necessary for cataract diagnosis, but it can be useful in complex cases or when planning surgery. It helps identify any irregularities that could affect your vision or surgical outcomes. Specular microscopy is a specialized test that examines the cells on the back surface of your cornea. While not always part of routine cataract diagnosis, it may be used if there are concerns about corneal health, especially before surgery. Healthy corneal cells are important for clear vision after cataract removal. In some cases, ultrasound imaging may be used to get a clearer picture of the structures inside your eye. This test is especially helpful if the cataract is very dense and prevents the doctor from seeing the retina clearly. Ultrasound helps ensure there are no other underlying problems before planning treatment. Optical coherence tomography, or OCT, is a non-invasive imaging test that provides high-resolution cross-sectional images of the retina. While not always required for cataract diagnosis, OCT can be helpful if the doctor suspects other retinal problems that could affect your vision. Cataracts can be classified into different types based on their location and appearance. The most common types are nuclear, cortical, and posterior subcapsular cataracts. Identifying the type helps guide treatment decisions and provides insight into how the cataract may progress. Doctors use a grading system to assess the severity of a cataract. This involves evaluating how much the lens is clouded and how much it affects your vision. The grading helps determine whether surgery is needed and how urgently it should be performed. All findings from the examination are carefully documented in your medical record. This includes the results of vision tests, eye pressure measurements, and detailed notes about the appearance and severity of the cataract. Accurate documentation ensures continuity of care and helps track changes over time. Once all tests are complete, the doctor will discuss the diagnosis with you. They'll explain whether you have a cataract, its type and severity, and how it's affecting your vision. This conversation is an opportunity to ask questions and understand your condition fully. If a cataract is diagnosed, the doctor will discuss treatment options with you. Early cataracts may only require stronger glasses or better lighting, while more advanced cases might need surgery. The doctor will explain the benefits and risks of each option, helping you make an informed decision. Cataract surgery is recommended when the cataract significantly impairs your vision and affects your quality of life. The decision is based on your symptoms, test results, and personal needs. The doctor will explain what to expect from surgery and answer any questions you may have. Before surgery, a thorough pre-surgical evaluation is performed. This includes additional measurements of your eye, reviewing your overall health, and discussing anesthesia options. The goal is to ensure you're a good candidate for surgery and to plan the procedure for the best possible outcome. Patient education is an important part of the diagnostic process. The doctor will provide information about cataracts, treatment options, and what to expect during and after surgery. Understanding your condition empowers you to make informed decisions about your eye health. Doctors take time to address any concerns or fears you may have about cataracts or surgery. Open communication helps build trust and ensures you feel comfortable with your care plan. Don't hesitate to ask questions or express your worries during this stage. If your cataract is mild and not affecting your vision significantly, the doctor may recommend regular monitoring. Follow-up visits allow the doctor to track any changes in your vision and decide when treatment might be necessary. Early detection and monitoring are key to maintaining good eye health. Doctors may offer lifestyle recommendations to help slow cataract progression. These can include wearing sunglasses to protect your eyes from UV light, managing underlying health conditions like diabetes, and maintaining a healthy diet rich in antioxidants. Such steps can support overall eye health. For early cataracts, vision aids, such as stronger eyeglasses, magnifying lenses, or improved lighting at home can help you maintain your independence. The doctor will suggest practical adjustments to make daily activities easier until surgery becomes necessary. Doctors may encourage you to involve family members or caregivers in your care. Having support can make it easier to manage appointments, follow treatment plans, and cope with any changes in vision. Medical teams work together to provide comprehensive care throughout the diagnostic and treatment process. Regular follow-up appointments are essential for monitoring cataract progression and adjusting your care plan as needed. The doctor will schedule these visits based on your individual needs, ensuring that any changes in your vision are promptly addressed. If surgery is recommended, the doctor will guide you through the preparation process. This includes instructions on medications, fasting, and arranging transportation for the day of surgery. Proper preparation helps ensure a smooth and successful procedure. Before surgery, you'll be asked to sign an informed consent form. This document confirms that you understand the risks, benefits, and alternatives to cataract surgery. The doctor will answer any remaining questions to ensure you feel confident about your decision. In some cases, your doctor may coordinate with other specialists, such as a primary care physician or an anesthesiologist, to ensure you're healthy enough for surgery. This team approach helps minimize risks and optimize your care. A final check is performed before surgery to confirm all preparations are complete. The doctor will review your medical history, test results, and answer any last-minute questions. This ensures you're ready for the procedure and helps reduce anxiety. To summarize, diagnosing cataracts involves a series of steps: initial consultation, medical history review, symptom assessment, vision tests, detailed eye examinations, and sometimes advanced imaging. Each step provides valuable information that helps the doctor make an accurate diagnosis and develop a personalized treatment plan. Early detection of cataracts is key to preserving your vision and quality of life. Regular eye exams allow doctors to catch cataracts in their early stages, when treatment is most effective. If you notice any changes in your vision, don't wait, schedule an eye exam promptly. Advances in technology have greatly improved the accuracy and comfort of cataract diagnosis. From high-resolution imaging to automated vision tests, these tools help doctors detect cataracts earlier and plan more effective treatments. Staying informed about new technologies can benefit your eye health. Being proactive about your eye health empowers you to make the best decisions for your vision. Understanding the diagnostic process, asking questions, and following your doctor's recommendations are all important steps in managing cataracts and maintaining your quality of life. In conclusion, diagnosing cataracts is a thorough process that ensures you receive the right care at the right time. If you or someone you know is experiencing vision changes, don't hesitate to seek professional evaluation. Early diagnosis and treatment can make a significant difference in preserving your sight and quality of life.